Hello, everyone. Welcome, welcome. Going to give folks a few minutes to trickle on in the room, and we have an exciting evening planned for you tonight. So excited that you can join us today as we kick off this Memorial Day weekend. Happy Wednesday, everyone. I'm a military child and a band nerd, and I normally start on time, but I am going to give people a few minutes to trickle in. I do fully acknowledge it is the middle of the week. We are going into a holiday weekend and people have real life responsibilities. So thank you for being here. We'll give folks a few more minutes. If you would like, it looks like the chat window is open. If you want to drop in the chat where you are joining us from, that'd be great. We have an exciting, these always go by so fast. We have an exciting webinar and meeting scheduled for you today. Okay, we have Raleigh, we have Atlanta. Durham, Bull City. All right. As we are still letting people in the room, I just also want to let you know that this session, Drop-In Hours with Dr. B, will also be live streamed on Facebook and also on YouTube. So if you are on either one of those platforms and would prefer to kick your feet up there and watch it on the big screen, we'll be on those platforms as well. Good to see your smiling faces. There is always one. There is always one. Good to see you. I'm not going to say names, but good to see you. I see a lot of new faces and I see a lot of familiar faces. This is fantastic. So good to see you. We'll get started in about 2 more minutes. While we are waiting, if you want to drop in the chat where you are joining us from, that would be great. Atlanta, okay. We're gonna go ahead and get started. You can leave your cameras on, you can leave your cameras off. Whatever works for you works for me, but clearly you will see all of my teeth and my gums today as we jump into this workshop. My name is Bobby Banks, and I am the innovator, one of the lead visionaries for the entire Drop-In Hours with Dr. B concept, but I have an amazing team behind the cameras doing a lot of amazing work, and want to acknowledge all the hard work that they have done to get us to this point. I'll tell you a little bit about who I am if you are wondering who is this person facilitating this discussion tonight, and then tell you why we're here and why we have started or kicked off this entire series with who we think are two powerhouse women dedicated to equity. My name is Dr. Bobby Banks, and I'm an epidemiologist by training in public health, but more importantly, I am a servant and I am a leader. I am a teacher. And I've spent my entire life committed to equity and communities. And I come from a very long legacy of women who were nurses, my mother, my great-grandmother, my grandmother, who were committed to community, who are committed to truth, equity, and justice. And the apple does not fall far from the tree. I am the founder and CEO of Pillar Consulting, where we engage with communities doing exactly what we're doing here today. Our mission at my company, Pillar Consulting, is to build capacity, to encourage innovation, and to foster change. And the effort that you are here a part of today is a direct manifestation of our commitment to this sort of work. And so we don't have time to go through all of the background information, but if you are familiar, Pillar Consulting kicked off a campaign last year called Not a Host. And it was a culturally relevant way to engage with marginalized communities around COVID. What does this mean? What does immune mean, or what does immunity mean? And there were a host of activities that we had as part of this campaign, including digital content. So we had digital, we had print, a host of user-driven content, you name it, really thinking about engaging ways to reach out to and engage with populations who are most disproportionately impacted by COVID-19. Think about African Americans, Latinos, Asian Pacific Islanders, First People, rural areas, thinking about those individuals and like, what is the best way to really message and package things? I'm a very red light, green light person, so give it to us straight. Red light, green light, what does this mean? United Way was generous enough to afford us this opportunity to facilitate these sessions here with you today. And so you are here as we launch and kick off drop-in hours. The concept for drop-in hours is very, very simple. We're bringing the experts to you. You are in the comforts of your home right now. So we are bringing experts to you who have been embedded in this work, not yesterday or the day before, or they didn't sleep at a Holiday Inn last night, but they have committed their lives to equity. They have committed their lives to justice. And because of the support of the Ride United initiative, you see the sponsors here on the screen: Blue Cross Blue Shield North Carolina Foundation, Lyft, Mako Documents, Wilcox Distribution, Duke Energy, Duke, United Way, North Carolina Department of Transportation, and North Carolina Department of Health and Human Services. We are able to kick off this series with you. We fully acknowledge that not everyone has access to technology. When we launched the concept of drop-in hours, we thought, well, let's connect with the Facebook demographic. I'm sure many of you found this opportunity on Facebook. So we're thinking about the folks are here in the digital space, and we also have print materials to supplement that as well. But we're going to kick off drop-in hours and tell you more about this entire reason we're here. We know that there's a lot of information out here on TV, on radio, on the internet, your cousin, your friend, your neighbor, really thinking about where can we come to a trusted space and ask our questions from people who have been there, who have done that. So the concept with drop-in hours is very, very simple. We're bringing the experts and we're asking them to drop in our community. We're here. We're asking them to drop their credentials because we know everyone is an expert now on COVID, on COVID-19 prevention, on COVID-19 treatment, on vaccines, on equity. We're asking them to drop knowledge based on the work that they have been committed to for years, decades, so that we can really have a clear picture of what's going on. And then we're going to ask them to drop the mic. So if you are from the generation that I am with Randy Watson, just thinking about a call to action when we leave this room, what do you want people to walk away with? Because there is so much information out here. What is the clear takeaway you want us to have? And when speaking with my team and the partners who support this effort, there was no question around who we should have kick off this series. There was no question. Many of you know, if you had your camera on, I would ask you, well, raise your hand. I want to know how many of you heard Tuskegee Syphilis Study, right? So you heard this at the beginning of the pandemic. And I thought to myself, do you know, like, we have roots right here at our fingertips. The whistleblower for the Tuskegee Syphilis Study was a child of the Carolinas, of the Gullah Geechee people of South Carolina, and sold into so many students and professionals across the United States, I'd venture to say the world. And his widow is with us today. He's no longer with us, but Dr. Diane Rowley is here to share a little bit more about Tuskegee, because what we also saw on the internet everywhere was everyone didn't have the information quite correct. I'll let her drop her credentials and tell you who she is. And our other speaker is, if you had to think about passing the baton in a relay, Dr. Sharrelle Barber. She is an amazing scholar, an amazing friend and former colleague at UNC Chapel Hill. And she is most recently named as the inaugural director. I'll go ahead and say the inaugural director of what I've abbreviated as the Ubuntu Center up at Drexel University. And I'll give the full name before we get off of the call today. That's the concept. So for the next 4 weeks, 4 months, on the fourth Wednesday at 6 p.m., we're bringing experts to you to do exactly that. Hey, can you drop your credentials so these people know you're legit? Drop the knowledge and then give us a call to action when we walk out of this room. And we're going to continue to engage with you over the next 4 weeks until we see you on June 23rd. Wink, wink. See you there. So, dropping in with us today are Dr. Rowley and Dr. Barber. And I would love to, I would love for you to formally drop your credentials for the people in the room so that they know who you are and what you have studied and why you are qualified to be here in this room today. And then we'll move to you respectively to drop the knowledge for the people in the room. If you have questions, this is the space. If you've seen any of the promotion for drop-in hours, bring your friends, bring your questions. That's why we're here. So we'll kick off, we'll defer to the legendary Diane Rowley, who is a legend in her own right. I just mentioned Dr. Bill Jenkins first because he was the whistleblower for the Tuskegee Syphilis Study. But Dr. Diane Rowley, please tell us who you are. Please drop your credentials. And I think you're on mute. I do it all the time.
Yes, I was on mute. And good evening, Dr. Bobby. I can't think of a more enthusiastic person that I've met in life than you. So it's wonderful to be here and to be invited to be part of the first of the drop-ins. My name is Diane Rowley. I am officially Professor Emeritus at the University of North Carolina. I'm in the Department of Maternal and Child Health. I've spent my career as an epidemiologist, trained first as a physician. I went to an HBCU, Meharry Medical College. I want people to understand it was very intentional that I went to an HBCU to learn about medicine, because I wanted to learn how to treat people of color with respect. And it's still a problem that people are not always treated that way. I did a residency in pediatrics, and then I decided that my life's work had to be in research and prevention. And so I did a 2-year training in epidemiology, in Epidemic Intelligence Service, and I completed a preventive medicine residency at the Centers for Disease Control, and did my master's in public health at Harvard, and then worked for 20 years at the CDC on a slew of things, but primarily on issues related to maternal and child health. After that, I went to Morehouse College and set up a research center on health disparities. I was there for about 7 years until I got the call from UNC to come and teach. So I ended up at UNC for about 9 years and retired in the summer of 2017 with my lovely husband that you'll learn much more about. So thank you very much for inviting me. And I'm really looking forward to talking about my dear hubby.
Thank you so much for joining us, Diane. Dr. Rowley, how excited are you that like the rest of the world understands what epidemiology means now?
Oh, it's fantastic to be wanted for a change. I started my career as an epidemiology training person in 1980, and people thought I was a skin doctor. Mm-hmm. Mm-hmm. Finally, everybody knows what epidemiology is, and everybody wants to be an epidemiologist. Well, maybe not everybody, but everybody should think about being an epidemiologist.
I would venture to say the same. I study epidemiology. I think I finished about 15 years ago, and study of skin. So it's still around. Hopefully, folks understand what we do now. Thank you for letting people know who you are. HBCU grad, Meharry Medical College, been to Morehouse, CDC, decades there. Started the Health Disparity Center there, and you'll talk about the legend. I consider him to be the father of public health when it comes to health equity, and really talk about what the Tuskegee Syphilis Study consisted of and what Bill's role was in that. All right, Dr. Barber, really quickly, or we can go however you want to do it. We had it scheduled. You know, it's your world. We can do it right now, or we can do it after Dr. Rowley goes.
Well, I mean, if it's okay, if I can just say it, one, Dr. B, we go way back. Thank you for the invitation. Dr. Rowley, just as someone who honors elders in this field, just grateful to share this space with you. So I'm just fangirling right now. I remember we invited you back you were at Drexel back in 2019. So it was just an honor to be here with you and to be in the presence even of Dr. Jenkins, because I know he is present very much so. And so just thank you for all the work that you've done to pave the way for us, you know, to be able to do the work that we're doing now, because I know it was a road that was not easy, and it's still, you know, not difficult. So just want to honor you and honor that work. So I am Dr. Sharrelle Barber. I'm a social epidemiologist, proud Bennett Belle, daughter of the South, daughter of North Carolina. And so really excited to be with you all tonight. I describe my work as at the intersection of place, race, and health, studying structural racism and how it influences the health, particularly of Black Americans here in the United States, but also have work that it has taken me to Brazil. And so during the COVID-19 pandemic, did some work early on with the Poor People's Campaign to help advise their health, their justice advocacy around the pandemic. Brought together a phenomenal group of folks from Harvard and UCLA, Dr. Chandra Ford, Dr. Mary Bassett, and others to really, you know, inform that movement as they were, demanding justice during the pandemic. Also have done some work here in Philadelphia locally, looking at COVID, the disproportionate impact in Black communities. Also part of a team that has been looking at COVID across the 30 largest cities in the country. There's a dashboard that that was co-created by the Urban Health Collaborative. And as Dr. Bobby Banks said, I am really excited because in the fall of 2021, we will be launching the Ubuntu Center on Racism, Global Movements, and Population Health Equity in a response to what we have seen in terms of both the pandemic and the state-sanctioned violence that we've all had to bear witness to in this year. Really excited about that and about being appointed as the inaugural director. So again, grateful to be here. Got a lot to say, and so we'll move on.
I'm fangirling on everybody right now. I shared with Dr. Rowley, my amazing team. Of course, we did our check-ins with you. After we signed off with Dr. Rowley, she literally slid out of the chair on the screen. Like, that's how legendary we know this moment is, to have her here to share more about Bill, Dr. Jenkins. So Dr. Rowley, we will give you the floor. Tell the people, I know Bill is not here to do the full drop in, but please let the folks know who the legend was, who was the whistleblower for the Tuskegee Syphilis Study, not the experiment. And we'll let you go ahead and do your thing. And if folks have questions, please drop them in the chat. We'll let her do her thing for about 20 minutes. We'll come back and have questions, and then we will let Dr. Barber go.
Okay, well, if I can get my screen to be shared, which is always a challenge for me, we will be okay. Let me see. I put my glasses on to get this thing up here. Okay, how am I doing? Can you see it?
We see you, and we see your screen, and we see you. You see the slides, and we see you.
Yes. Good. All right. So actually, I have to admit, this is not my first time giving this talk, but I am loving the fact that I get to do it every time because I love to talk about my husband. So And I think this community that I'm talking to probably didn't know him. So let me introduce you to Bill Jenkins. He was a family man. This is Bill and me at one of our happier times. He has a daughter, Danielle Rowley Jenkins, and he had the most magnificent smile that I had ever seen. When I met him in 1980 in the lobby of CDC, we didn't get along exactly. It wasn't love at first sight, but we were married 3 years later. So things worked out pretty well. He was born in Mount Pleasant, South Carolina on July 26, 1945, William Carter Jenkins. His mother was from the Gullah Geechee community, and his father was a prominent Black businessman from a family of Black businessmen in Charleston. But Bill actually grew up in his mother's village in Mount Pleasant. So he was primarily exposed, he was exposed both to the Gullah Geechee community and to the more formal Charleston community. And recently, before he passed away, we checked on our African ancestry. You know, there's a Black-owned genetic company that will provide you information about who your family was 200, 300 years ago before you arrived in the United States. And he found out that he is Mindi and Balanta, both people of Sierra Leone. So what I want to do is briefly tell you about his experience as a whistleblower, of the Tuskegee study of untreated syphilis in the Negro male. That's the formal title of the study. What happened, talk a little bit about what happened after the study ended. And then Bill went on to his career, and 20 years later, he was once again asked to get involved in issues related to the study. And then you'll hear him talk directly about his version of what happened at the study. And I'll end with a brief commentary about the vaccine. So what drove Bill's career? First of all, he loved epidemiology. He was actually working as a biostatistician in graduate school, getting his master's in biostatistics, when he discovered epidemiology and decided that that was going to be his career. In addition to that, he'd always been dedicated to social justice. When he was a teenager, he registered people to vote in Charleston. And when he attended Morehouse College, he was a volunteer for SNCC at the Student Nonviolent Coordinating Committee. This was in the early 60s when John Lewis was still the director of SNCC. And one of his most proudest moments was sharing a jail cell with John Lewis after they picketed a restaurant in Atlanta. His first job was at the National Center for Health Statistics in Washington, D.C. After he graduated from Morehouse College in 1967 with a degree in mathematics, he was one of the youngest African-American men recruited to join the Public Health Service Commission Corps. And he was recruited into a training program to become a biostatistician. Now, because he had always had this sort of natural ability to organize, he organized an underground network of public health employees when he got to DC. And they had their little meetings, and they started a communications letter, a newsletter called The Drum. And in those days, and I remember he would tell me, you know, late at night after everybody went home from the job, he used the graph machine to run off copies of the Drum and circulate them to the rest of the employees. So about a year into the time that he worked at the National Center for Health Statistics, one of the other older gentlemen came into his office and said, I want you to take a look at these studies. And Bill has been quoted, as saying, this was unusual because this guy was not exactly a friend of Bill's. This guy was kind of a friend of Bill, as a matter of fact, because Bill was this radical 60s guy. So he knew there was something important for him to look at if this guy was willing to keep him coming to his office. And I want you to hear what happened after he started reading about the studies.
Of the Public Health Service, and here the first rumblings of concern begin. A young epidemiologist learned about the study and tried to have it exposed. We collected the studies, put them in a package, and sent them to the Washington Post and the New York Times and so on, and waited for the major break. It never came. We were fairly naive about how the media worked. Now we would know that we should have written a press release and we should have, had the contact and we should have followed up. At this point, we thought all we had to do was tell them something was wrong here and everything would be all right and everybody would understand. Everything was not all right, not everybody understood, and nothing was done.
So during that same time, on the other side of the United States, Peter Buxton was also a CDC employee, very concerned about the study. And he actually wrote to his supervisors at CDC and asked that the men start being treated. He wrote to them several times. And finally, in 1969, he received a response saying that there'd been a scientific review of the studies, and the committee decided that they did not recommend that the study group be treated and that the study should continue. Peter Buxton eventually left CDC and went to law school and continued to tell everybody about the study until finally he met up with a reporter from the Associated Press who was very interested in writing about the study. And she wrote a very scathing article that was sent out nationwide. And that's finally what stopped the study. Senator Ted Kennedy read about the article, decided to hold congressional hearings, not just on Tuskegee, but on issues of human experimentation. Now, the initial reason was because of the Tuskegee Syphilis Study, and he eventually gave Jean Heller, the reporter, an award for the work she did to reveal what was going on. As a result of that, the study officially finally ended around 1972-73. And several things evolved out of the hearings, the congressional hearings that Senator Kennedy had. One of them was the Tuskegee Participants Health Benefit Program, which was mandated by Congress that all of the participants in this study, the widows and their children, receive medical and health benefits for the rest of their lives. And that was CDC's responsibility to do. More importantly, and what really changed the whole conduct of study in the United States was the passage of the 1974 National Research Act. That required that all research being conducted on health in the United States or any research funded by the US had to undergo a very serious protocol and live under regulations. So for the first time, as a result of Tuskegee and other experimentations, researchers were under the microscope, proved that they were not causing harm and that they actually were doing things that were beneficial. So anyway, Bill went on to graduate school and had a very productive federal career at CDC for 20 years. And as a matter of fact, he always was at the forefront of whatever controversy was there. For example, he was in the department, in the division of CDC that managed the AIDS, HIV epidemic. He was there from the beginning. The first AIDS case was reported in 1981. He was a biostatistician who actually was involved in data analysis on the AIDS cases. And he was one of the first to realize that this was not just a disease of gay white men. This was an illness that was much more widespread. And he helped convene a national conference on AIDS in minority communities, and eventually became the first director of minority health, AIDS, HIV community prevention programs for the nation. He did that for a while working on a bunch of other things. But I want you to know that he did one of the first analyses looking at the projected possibility of how bad AIDS could be in the Black community. And that analysis appeared in 1992 in a chapter, one of the first chapters on the AIDS epidemic in the Black community, in a book called Health Issues in the Black Community. And there have been multiple editions since then. But this was the first time that people had enough of information about what was going on and on the need for programs and the type of programs. He was adamant that if we were going to do anything to reduce or prevent AIDS, we had to bring in community organizers and community people to decide how to do the education and prevention. So, in 1995, the previous manager of the Tuskegee Participant Health Benefits Program, the one I told you that started in the 1970s, that manager retired, and Bill was appointed to be the new director of that Tuskegee Participants Health Benefits Program. There were still survivors and families that were receiving medical care. And one of the things Bill did, and his predecessor had started this, but he visited those families every year. He or a member of his staff spent much time on the phone with the survivors. He had a social worker who worked with the families, and he got to know the families very well. At the same time, people who worked with me, my group was working in maternal and child health issues, and we were conducting studies with Black women. And one of people in my group said, CDC really needs to apologize for conducting the Tuskegee study. Nobody has ever really apologized to the families. And she wrote a letter to Bill. And of course, because of his lovely wife's insistence, he initiated a process for getting a CDC apology. And the way to do that, if you're a federal worker, is that you call people from the outside and say, I'm forming a committee to get your advice about how to do this. And the people that he convened for that committee said, we don't want an apology from CDC. We want a presidential apology. And so that's what they worked on. During that same time, Bill became a producer. He produced one of the only documentaries that actually interviewed the survivors of the study and their family members to get their take on what it was like to be part of the study and how they felt about it. So in 1997, President Clinton agreed to provide a presidential apology. He invited the survivors and their families to the White House. It was a very big deal. TV stopped, and it was one of the few times when in those days, there weren't a whole lot of channels, but all of the channels aired the apology on television. And Mr. Herman Shaw, one of the survivors spoke for the families at the White House. And I want you to hear his voice and hear what he asked for as part of the apology. So Mr. Shaw, among other things, started off by saying the damage done by the
study much deeper than the wounds any of us may have suffered. It speaks to our faith in God and the ability of medical science to serve as a face, as a force for good. And I said, in Sharrelle Baptist Church in Norfolk, Alabama, on April 8th, in addition to the apology, we want to construct a Tuskegee permanent memorial. Children will be able to see the contribution that we and others made to this country.
Yes, he wanted a memorial. They wanted people to understand the contribution that they had made to the country.
Tuskegee Study.
I'm sorry. Let me move on. So, Bill was involved in setting up the memorial, setting up an ethics center at Tuskegee University to train the next generation of ethicists, specifically people of color, who could comment on existing and future research in an effort to try to make sure that people were not being abused. And he frequently lectured about the Tuskegee Syphilis Study because as the manager of the health benefits program, Bill was the person who gave access to all of the archives about the study. He would go to the archives and read about the correspondence. He'd pick up photos. He allowed other people, other historians into the archives. So he became not just a whistleblower and not just the person who arranged the apology, but an expert on the details of the study, and he shared them. One of the things he always wanted people to understand, based on his knowledge about these men and having gotten to know them, they weren't victims, he said. He saw them as heroes, trying to do something good for their community. And that's the way he wants them to be remembered. When he visited them, I can remember him coming back and talking about how graceful and dignified and respectful the men were and how much he respected their lives and the way they lived their lives. He wanted people to appreciate them for the contribution that they made to changing the way research is conducted throughout the world. And just the other day, I heard Reverend Al Sharpton talk about the George Floyd Act, trying to get that through Congress. And he kind of echoed those same remarks. He said, George Floyd was not a victim. George Floyd was a game changer. And that's true of the participants of the Tuskegee study as well. So now I'm going to end with having you listen to Bill describe his version of what happened and what it meant.
Thank you. I don't have any data to present today. I'm going to do what the old men in the fishing village I grew up in do, and that was to tell a story. So that's what I'm going to do. This story also starts in 1895 in Atlanta, Georgia. Booker T. Washington gave perhaps the most important speech in Black American history. In it, he accepted segregation on the one hand, requested support for financial support for his Tuskegee experiment. The Tuskegee experiment was the most comprehensive economic development program for African Americans in the history of this country. It is so unfortunate that out of the incredible story there, that the one bad thing that happened in that experience is the one thing people remember. The Tuskegee experiment laid the groundwork for public education in America. It saved the agricultural system. This is George Washington Carver as a young man with his research team. It also started the Negro health movement. And if you want to know how to work in communities, look at the Negro health movement. It started the National Medical Association, National Bar Association, National Nurses Association, and the health interventions that it created was inventive and included the community at all levels. However, as you know, health impacts on economic development. And when it was found that about 25% of reproductive age persons in that county was positive for syphilis, it became necessary to start an aggressive medical intervention with the use of mercury and arsenic. Little problem with mercury and arsenic, as some of you might know. But even though the program was substantially successful, the Wall Street crash, as you might relate this to what's happening today, and support for those medical programs waned. And so they went to the one place that could provide that support, the federal government, the Public Health Service, my old organization. And that organization, Farrah Clark, who was the director of the venereal disease branch at the time, said, well, if these men are not being treated, let's follow them for a year and see what health impact it has so we could justify rebuilding the treatment program. And so they decided to follow the men without treating them for syphilis for that first year. They recruited men into the study. I'm privileged to say these are the men that in my years at CDC I also had the opportunity to take care of. They used the church to recruit people into the study. And once they had recruited the 600 men in the study, 300 with syphilis, 300 without, Nurse Rivers, or Mrs. Laurie as I knew her, would take physicians from CDC every year. They would introduce them to the men and interview them. They would take assessments right there in the field, mount the data, collect the data right in the field. It was a very well-managed program. 600 men, or a little more actually, followed for 40 years with a loss to follow-up of 17%. The reason the Tuskegee study was so unethical, it was in part due to the fact that it was so successful, so well-managed. Think about that when you're working in a community. So the study was criticized, and they were concerned about whether the men were being treated. So they asked local physicians not to treat the men as long as the study was going on. And that continued to happen. Even when World War II started and men were going into the military, they got the men exempted from the military so that they wouldn't be treated for syphilis. After penicillin was established as the treatment for syphilis, the men were denied penicillin so that they could be followed to death. Things that start with a good purpose could end up being a very bad thing. It is important to understand that. So around 1968, with Peter Buxton in California and I in Washington, editor of the Drum newsletter, trying to bring some attention to the study, seeking an end. Those efforts were rebuffed until Peter got a reporter with the AP who was able to write that first article. And after that, there was a lot of discussion. Ted Kennedy held hearings on the study, and then the study ended in 1972. 40 years without being treated. I'm sorry. This study changed the way we do medical research in America, and that has been a good thing. But there's some issues that still remain. Racism remains a major determinant of health and healthcare in America. And one of the things that's troublesome to me is that Americans work very hard to pretend it no longer exists. Afraid to even use the word racism on national television. So I want you to do something for me. I just want you to say the word. It'll be okay. It'll be okay. Say racism. Thank you. The earth did not tremble. The building did not fall down. It's okay to use the word. Because I really do believe there's no race problem in America. There's not a race problem in America. There's a racism problem in America. It is the only health condition where we want to study the symptom, race, rather than the ideologic factor, racism. It's amazing to me as an epidemiologist. To solve health disparities, we must also study racism. And not just among European Americans. It is a mental illness that affects all people. Let me tell you a little thing about what's happening today with regards to community participatory research. I want you to understand that the Tuskegee study was, in fact, a community participatory program, research initiative. It met all the criteria of community-based project. And in addition to that, there's no study which appreciated cultural competence more than that seen in Nurse Rivers and how she got these men to continue to participate in this conference. The notion that community participatory research that all of us wanted to push for in 1991 as a panacea is a mistake. It is an important thing to do, but it will not solve all our problems in this area. A good start can have a bad end. To the extent that community participatory research is getting people into clinical trials or assessing genetic differences alone, the ethics must be questioned.
Okay, I'm going to end there. So if we want to have a discussion at some point this evening or at a later date, I can tell you what I think what Bill would say about the COVID-19 vaccine. I'm going to turn this back over to you.
I always feel, I don't know how many people had the privilege of sitting at their grandmother's feet or their grandfather's feet, but sitting in rooms with you and Bill as a student and seeing two people who spoke truth to power without fear for marginalized people taught us how to sit at tables and to speak truth to power and to stand up for those who do not have a voice. And so thank you for sharing this with the broader community so that we really understand what the study was about, that there are people there blowing the whistle, that Bill was responsible for getting the acting surgeon general's name during that study taken off a building at a university. Consistent, steadfast, unwavered, unmoved, and unbothered. Standing up for people. And so what we see happening with this COVID pandemic is it is the after effects, the lingering effects, and the persistent effects of structures and systems that leave populations more susceptible to disease. Like literally your bodies are battered. Thank you for sharing Bill with us. For those of you who never met Bill, who never met Diane, they sat in student meetings. I happened to be at that conference and I see someone in the chat saying I was there in the audience when they said that, and we were all blown away at Bill's saying, just because you don't say it doesn't mean it doesn't exist. And so we want to leave a few minutes for people to ask questions of Diane while folks are, Dr. Rowley, while folks are asking questions. I would love to hear from you. So we know, right? So we know that there is historical distrust of the medical establishment, and we know there's a lot of other work that still needs to be done, right, with systems and structures. So when did you realize, when you saw this pandemic coming down the pipe, when did you know that it was going to be a problem given the systems and the structures that are at play, and how we are working diligently every day to make sure that populations have access to what they need?
Well, we were together, Bobby, when I knew there was a problem. We were working in New Jersey together on a maternal and child health topic. My first 2 years of CDC, I spent in the viral disease division, being trained, and I worked on influenza and other forms of infectious diseases. Mm-hmm. And when I saw what was going on in California in February, I knew that I was going home and not coming out again. So I started self-isolating early in March, even before there was clear evidence that the COVID was spreading throughout the South, because I knew it was coming. And I knew that the news reports were not doing us any favors by claiming, that we could flatten the curve if we just stayed home for a few weeks or a couple of months. I was furious because I knew this thing was going to last for a very long time. If you know anything about epidemic curves, they keep going up and up and up and up and up. And even if you try to flatten them, it's just going to extend the process, and the curve is going to continue until we had real prevention strategies. Mm-hmm. And we knew very early that there was a terrible disparity in who was getting sick and who was dying. Mm-hmm. And I just want to say that should have been the rationale for who got vaccinated. Mm-hmm. If there was going to be a treatment, American Indian, Native American populations and Black people of all ages, because they were dying young, not just old people, should have been at the top of the priority list for who to be vaccinated. Mm-hmm.
And this is what we explain to our students what equity means, right? The people who are disproportionately impacted in new cases with death, with mortality and hospitalizations, this is equity. You go where the problem is, not only with testing and treatment, but also with vaccine access and distribution. And we'll talk about transportation and so many other things that people don't have access to. But this is why folks like Dr. Barber and so many others are on the front lines, continuing the legacy of Bill and really speaking truth to power in these spaces. You named all of these populations, right? American Indians, I think we had Doctors Without Borders that had to come over to help. What? To have an international crisis organization come to the US to go to the Native American communities to lower COVID risk was mind-blowing. And thinking about our Latino brothers and sisters and thinking about people in rural areas. And so thank you I forgot we were together when that happened, and I had I've been on vitamin C and vitamin Z, or zinc, I'm sorry, zinc and vitamin C since that time. I forgot we were together. Thank you, because I think it came as a shock to so many people that it got so bad. But for folks who work in this space, who work in epi or who work in equity work, knew who was going to get the punch. We're going to go to Dr. Barber, and then we're going to wrap up. For those just joining us, welcome to Drop-In Hours. We have our experts dropping in, dropping their credentials, dropping knowledge about their relative expertise. And we just learned about the legend, Dr. Bill Jenkins. And we're going to transition now to Dr. Sharrelle Barber, and invite you to send direct questions to one of the brilliant people on my team if you have questions. And want to remind you that this is a space, this is a no judgment, no frills, no pony, no circus. This is a space where you can ask your genuine questions. We want to make sure that people have factual information to make informed decisions about their health. We're not here to persuade, guilt, anything around that, but to give you the best information to make a decision for your health. So here we are, giving the real deal information. We'll wrap up with Q&As, and then, oh my gosh, I cannot believe it's almost over. No, why? I could sit and listen to you all, both of you, all night. Dr. Barber, please drop the knowledge for the people. Equity.
Absolutely. Yeah.
Equity.
Thank
Are
you
we
so
there
much.
yet? Are we there yet?
I just want to acknowledge Dr. Rowley, and just it's raining and thundering here in Philadelphia, and I acknowledge that as the ancestors being present. And so I have felt Dr. Jenkins in this space tonight, and just want to honor you for continuing to share his legacy. And I was there in 2010 at that conference, and remember hearing him say that so unapologetically. And again, it's folks like him and others that have been saying these things for years that have inspired so many of us to continue this work. And in speaking of Indigenous peoples, I want to do a land acknowledgement, which I've come to do, especially in this past year, as we've seen the devastation of the pandemic. But just to say that the work that I do here in Philadelphia, I want to acknowledge that the land on which I gather and do this work are the ancestral lands of the Lenni Lenape people, whose presence and resilience in Pennsylvania continues to this day. We take this opportunity to honor the original caretakers of this land and recognize the histories of land theft, violence, erasure, and oppression that has us here. Also want to acknowledge that we are approaching 600,000 deaths in this country, millions, hundreds and hundreds of thousands around the world, that we cannot enter into the space of talking about equity without remembering and acknowledging the loss of this past year. And if we are going to move forward in a way that is equitable and just and humane, honoring the dead is what we have to do moving forward. And lastly, cannot leave this space or talk about equity in this moment without acknowledging the horrific state-sanctioned violence that we've all had to bear witness to in the midst of a pandemic, made even more heartbreaking because of it. And these are just a few of the faces and the names of individuals who have been lost due to the violence that is racism. And so just wanted to take the time to acknowledge Breonna Taylor, George Floyd, Ahmaud Arbery, and so many others. So the questions so Dr. B, I got into my professor mode because you were like, okay, are we there yet? But then I was like, well, let me back up and how did we get here? Then answer the question, are we there yet? And then say, well, where do we go from here? And that's kind of how I want to structure this. I know we're tight on time, so I'm going to try to breeze through some of the slides that I have, but I did want to really structure this in this way. And again, have reflections based on my role as a social epidemiologist who's been working in this space for over the past year. First thing, we will never forget that the origins of the amount of unnecessary suffering and death are with the I say criminal and the response that the past administration had. And there are many, 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 many people who have said that in the public health and medical community, that the pandemic was going to hit us, that it was going to be here, but it was made worse by the very irresponsible ways in which the past administration handled things. And it has trickled down, and we know has impacted our communities, Black communities, Latino communities, Indigenous communities, poor communities more, that his the past administration's lack of care in this area negatively impacted us. We also have to remind ourselves that public health has been gutted over many, many years, that we also got here because the public health infrastructure in this country has been decimated in so many ways. And again, this has had a negative impact on how we were able to respond, particularly in the most marginalized communities. I would also say that we have not, on a broad scale, focused in public health departments and in public health on equity and justice broadly, right? We talk about it, we dance around it, but there's still so much room to grow in terms of this equity space and how we really address these issues. So the lack of funding and the disconnect from public health departments and equity, I think, also caused us to be where we are. And then, of course, as Dr. Bill Jenkins, has said, and so many others, racism in this country is United States pre-existing condition that we can't understand how we got here in COVID without understanding this long legacy of racism, rooted in settler colonialism, rooted in the institution of slavery, rooted in the expulsion of Native American peoples from their lands, and the ways in which systems and structures have been created to uphold the racism that exists in our country today. And that racism has been the reason we've seen over time the disproportionate mortality among Black Americans, but also other groups, where Black Americans die at higher rates for 9 out of the 15 highest leading causes of death. And we see this and have seen this persistently. And so you asked Dr. Rowley, when did you know that this was going to be a problem for us? And a group of us actually back in March started writing a piece called Racism in the Time of COVID-19, and we said this, while COVID-19 is indiscriminate in its transmission, its propagation within a society steeped in structural racism will undoubtedly, as we are already beginning to see, lead to disproportionate impacts among marginalized racial groups in this country. We said this when people were saying, oh, this is going to be the great equalizer. Oh, this is going to hit everybody the same. But way back in March, before the numbers and the data even began to emerge, we knew this was going to be a problem for our communities. And we also wanted us to move away from just what was happening within healthcare settings and even public health to say that there are systems and structures that are interlocking that have led to this disproportionate impact. So we can't lose sight of racial capitalism, segregation and dispossession, our exclusionary immigration system, mass incarceration and detention, extractive polluting industries, and on and on and on, and how they have compounded and amplified the social and structural determinants of health that have led to differential exposure and transmission, differential susceptibility, and severe disease and death. And that is what has led to these racial inequities. And I always talk about, use this slide because, again, as we're emerging from this pandemic, if we don't look at the root causes and really understand how these interlocking systems are at play, we'll move forward and only focus, for example, on just healthcare or public health. And we have to be focusing on all of these things. And so that's led to the numbers that you've all seen. It's also led to the disproportionate ways in which the changes in life expectancy have happened, where we have Black men who've lost 3 years of life during this pandemic, the highest among all, racial groups in this country. This is big, this is huge. And again, we can't lose sight of these numbers. And so what we've really been seeing in this pandemic is embodied racism, right? All of the ways in which structural racism becomes embodied and shortens the life expectancy, particularly for marginalized racial groups in this country. And Ta-Nehisi Coates has this wonderful quote, well, not really wonderful, but a very poignant quote between the world and me, where he says, but all our phrasing, race relations, racial chasm, racial justice, racial profiling, white privilege, even white supremacy, serves to obscure that racism is a visceral experience, that it dislodges brains, blocks airways, rips muscles, extracts organs, cracks bones, breaks teeth. You must never look away from this. You must always remember that the sociology, the history, the economics, the graphs, the charts, the regressions all land with great violence upon the body. And that's what we have been experiencing in this pandemic, where we have seen the devastation within our communities and the impact that this pandemic has had because of the institutions and the structures and the systems that have always been set up to cause death. And so as a part of the work that I've been doing in Philadelphia, we've been trying to say, make this real through data and stories. So we started this project last year called COVID into Context. And one of the, community, I think, is where both the understanding of how this pandemic has played out, but also the solutions are. And we did a series of community conversations and one-on-one interviews with individuals on the front lines. And there was a young man in his mid to late, his early 20s who said, "What's a pandemic to someone already experiencing a survival mentality? What's a pandemic to someone who's already experiencing a survival mentality?" So there have been individuals and communities who have literally just been attempting to survive pre-pandemic. So what is a pandemic to people who have been constantly surviving? And I think that's the question we must ask ourselves is, what were the pre-pandemic conditions that led us to the point where people were literally just trying to survive, right? As opposed to thrive. And so this is our team who's been phenomenal. And we really took a historical perspective, understanding, again, those historical and root causes, and found for example, in Philadelphia, the hardest hit communities are in West Philadelphia and in North Philadelphia, where we have, again, high levels of segregation, high levels of disinvestment. And we saw early on in the pandemic where the rates were 2 times or twofold higher in the most segregated communities compared to the least segregated zip codes. Now, over time, the cases and the inequities in cases have declined. However, death rates are about 70% higher in our most segregated communities here in Philadelphia compared to the least segregated communities. Again, what does this mean, and what have we heard from people on the ground, again, which I think, again, are the ones that we need to be listening to in this moment. They talked about issues with housing. They talked about issues with transportation. They talked about losing their jobs and their way of life. There's also this, I think, underlying trauma that we are going to have to be dealing with past this pandemic. There was a woman who told us the story of her son who works in a hospital as a maintenance person, who during the pandemic was asked to help bag bodies because there was not enough staff to do that at the height of the pandemic. And I want you to think about that switch in terms of their job description during the pandemic, what that has meant for that individual's mental health and his inability to say, no, I'm not going to do that, or because he needs a job, he needs a paycheck, right? And I'm sure there are countless other stories just like that or similar of the ways in which this system continued to grind, particularly our most marginalized populations during this pandemic. And we have yet to uncover what that impact has been and what we'll need to be thinking about long-term from this pandemic. And as much as I talk about the harm that is racism, we showed up for each other during this pandemic. In Philadelphia, we had something called the Black Doctors COVID Consortium. Black doctors who said, oh, y'all not gonna get us testing? We'll set up mobile clinics in the hardest hit communities and make sure they get tested. Once the vaccine came out, they set up mobile units in churches and other places to make sure people got vaccinated. They were ready to go. They were poised and ready to go once they found out that our communities were not getting the services they needed. We also know, and this has happened across the country, mutual aid groups who have provided food, made sure elderly were taken care of, making sure individuals were taken care of. The harms of racism, yes, cause a lot of pain, but the power within our communities make sure that we survive this pandemic. And I think that's another critical point that we must learn from this, is that resilience, or I don't even like the word resilience, but that we show up, right, during crises situations. So are we there yet? I would say the data says, generally speaking, we're getting better, but the inequities still exist. This is for cases, hospitalizations, and deaths in Philadelphia. Again, we're still seeing gaps. In terms of the vaccine, again, my problem with how we kind of rolled out the vaccine, and Dr. Rowley, alluded to this, is, we knew which communities were the hardest hit, either demographically, geographically. We should have had a game plan day one when the vaccine distribution started to make sure that those communities had access, and we didn't do that. Instead, we blamed the lack of vaccination on, individuals' hesitancy. There's hesitancy. There was. I was hesitant, right? However, you cannot overcome we failed to overcome the access issues, the real access issues that were dominating. And, I said in an NPR interview, which I kind of got in a little bit of trouble for, that we were more reactive than proactive here in Philadelphia. And I think that is the case in some area, some other areas across the country. Also want to say that we've got to be thinking about who again has suffered and has experienced the loss of this pandemic. In Philadelphia, what we found was that more Black and Hispanic individuals know someone who died, compared to whites here. So just the grief, the loss in our communities has been much greater. And then when we think about what jobs have been lost, it's been those jobs that are predominantly occupied by Black and brown and poor individuals in the city. And we're just beginning to understand what the economic ramifications of this pandemic are. And so, as a social epidemiologist, these are the things, in addition to, do people have access to vaccines? Do people have access to continued testing and care? These economic and social conditions are also paramount, again, if we're going to be focusing on equity. So are we there yet? Not quite. I don't think we are. So where do we go from here? So vaccine equity, of course, is at the forefront of individuals' minds right now. We need to continue to press forward with that. I think we do need to be paying attention to the who is not vaccinated at this point. For example, in Philadelphia, what we see is that it is young adults. The gap is wide, the racial gap is widest among young adults in Philadelphia. So we need to be thinking about how we target our messaging and our outreach to that demographic, not just Blacks overall, because older folks in Philly were ready. They were poised and ready to get the vaccine. So again, we need to be thinking about all of the ways in which vaccine equity needs to be addressed. Testing, treatment, and sustained prevention measures. We need to continue to make sure that everyone is safe. I will say, I'm not sure that, there was an article that released by the New York Times. I think it was the New York Times, but it said a lot of epidemiologists expected us to be wearing masks through the end of the year. So the fact that this mask, recommendations have come out, I don't know about that. We need to still be focusing on public health prevention measures and not just individuals. Sustained access to economic relief and recovery, and economic and racial justice. And I'll end by saying that our way forward, where do we go from here, is yes, all of the things we need to do to address public health, all the equity in public health, equity in our healthcare systems. But if we're gonna call out racism as a public health crisis or racism as the fundamental driver, then we need to address it through policy. We need to address it through real action. We need to address it through movement. And that's because we know that that's the way that things have moved in this country. So I'll end here with a quote from an article that was published in Epidemiology earlier this year. It asked about 20 epidemiologists from all over the country to reflect on 2020. And this is what I said. I say, if our field is truly committed to preventing death, saving lives, and eliminating racial inequities, then we can no longer be content with the status quo. In this moment and beyond, we must rise, resist, and align ourselves with the communities and social movements, demanding the kind of radical restructuring of society that we all deserve. Silence is no longer an option, and speaking truth to power is the only way forward. Justice demands it, and our collective lives, you so porque no somos, I am because we are, that's Ubuntu. Our collective lives depend on it. If 2020 has not convinced us of this, I fear nothing else will. Thank you so much for your time. I know I sped through that, but thank you for allowing me to share with you all tonight.
Daughter of North Carolina, Bennett Bell. Thank you for sharing that. We are very
Absolutely.
intentional about kicking off this drop-in hour series, just not jumping into the issues. Let's just start talking about COVID. Let's just start talking about vaccines. Let's just start talking about this, but really understanding how did we get here? And then we can start talking about the specifics that'll help you understand this a little bit better. Thank you. Thank you both.
Absolutely. Absolutely. Thank
I
you.
would love to, as my late mother would say, get your lessons. I got my lessons on today. I would love to hear from the people in the room if they have any questions. There was one question, Dr. Rowley, and of course, you and Sharrelle have talked about vaccine access, right? There are people who would like to get access to the vaccine and cannot. There are people who do not. I mean, we have the spectrum of people who would like to get vaccinated and people who do not want to get vaccinated. That is okay. We can, you navigate through your decision making your way. Would love to hear from you. We're looking in the comment section. What would Dr. Bill Jenkins say about the vaccine? And then I want to hear from you, if you care to answer, what factored into your decision making around the vaccine? Because I think all of us are like, whoop, when they said it was ready, or they said it was coming down the pike. I want to know, what would Bill say? And then would love to hear from you, knowing through a lens of equity and knowing about access and opportunity and how folks were skipping lines to get the vaccine.
Mm-hmm. Yes, well, I just want to share one or two more slides, because let me tell you, my family members called me and wanted to know, what would Bill say? What are you thinking? We're waiting to hear from you about what to do. So Bill would have looked into this very carefully. He would have wanted to know, is the vaccine harmful? Is the risk, what's the risk benefit? Is the risk of COVID worse than getting the vaccine? And what are the ethics about getting the vaccine? And just to make it clear, we would have gone through, which I did with several people, we would have gone through a series of evaluations, research, looking in detail at the clinical trials following the initial adverse events reports. As I told my family, let's wait till the first 3 to 5 million people get the vaccine and see how they do. And then I'll let you know what I think. And so in terms of the risk and benefits of the disease, this is a horrible, horrible disease. You have multi-systems affected, people getting with underlying conditions, having very serious illness, people who get over the illness still are sick. And the rate of death is incredibly high. Just look at all the organs that are affected by the disease. So let me just move to the bottom line, which is, Bill would have said, he's a statistician, the probability of serious illness from COVID versus the probability of harm from the vaccine is a no-brainer. Get the vaccine. We know it's safe. We know it stops illness. We know it keeps people and your family from getting sick. And as a public health person, he would have said, this is an important public health program that needs to be promoted. I think he would have compared, he went through this with the AIDS epidemic, trying to get people into understanding about AIDS and getting them to protect themselves. And he would have said the same thing about the use of vaccine. And I think if he had to make a statement today, he would have said, there's been too much discrimination, not only in terms of who gets sick, but who has not been able to get the vaccine. And he finally would have said, let me skip all that. The same thing that Dr. Barber just said. We need to find out why community members might still be reluctant to get the vaccine and respect it. And we need to help them work through the decision making. Actually, yesterday, I spent half of my day with a classmate from high school, very brilliant woman, who called me and said, can you come with me to get my vaccine? I'm finally decided to get it. This is after 6 people in her house and her family had died. And we had been talking for months. And I never said to her, girl, what's wrong with you? But when she was ready, I said, I will be happy to go and hold your hand while you get your shot, because that's what she needed.
Thank you for saying that it really is a personal choice based on, as you said, I'm a qualitative person. I'm always asking questions, right? So like, tell me more about your decision. So the fact that you let your friend make her decision her way and her time, and it might have come yesterday, it might have not come at all, but helping to provide her with the best information. One of the examples I give Dr. Rowley is like, I grew up in a household of men. I probably should know cars. I don't. I really do not. Like, if you said carburetor or any other part of the car, I don't know that. I don't have familiarity with that. So don't have an expectation that I fully understand it or know how to purchase one. But if you help navigate me through that process and help me to make the best decision, that's very, very different. I still don't have to get the car. I still don't have to get it repaired, but there's nothing worse in my mind than making a decision based on wrong information. Like, oh my gosh, that to me warranted a place and a space to say, okay, let's just make sure we got the nuts and bolts tight and you fully understand, and then go on and make it. But if it's based off of some nonsense like, oh, it's only 1 mile per gallon, that's just not realistic. That's no, absolutely not. Thank you for sharing that. I'm looking for more questions in the chat. We're down to, oh my gosh, the last 10 minutes. I cannot believe this, the last 5 minutes. But love to hear from the folks in the room if they have other questions. Let me see. Oh, Dr. Sharrelle, if either one of you want to share, you talked about your friend, Dr. Rowley, but Dr. Barber, Dr. Rowley says she's going to let the first couple million go ahead and do their thing. And then tell us about if you care to share, your decision making.
Absolutely. I mean, it was the same. And actually, when folks started asking me, are you going to take the vaccine kind of earlier in this year, it was the same, like, okay, let me look at the data. Let me look at what's going on. It was those same decision points. And then that conversation we had with the Black and Brown Women's Alliance out of Guilford County, where I discovered in that and some of the conversations we were having here in Philadelphia, that people had legitimate questions. And I don't think the messaging early on was addressing those legitimate questions. The messaging was, oh, Oprah's getting it, or whoever, some celebrity is getting the vaccine, you should get it too. But that was us. That was like a slap in the face in terms of us being able to make the intelligent information, not just on somebody else is getting it. And I think that actually, for me, that was insulting, And so the approach to how to, get the right kind of messaging out was just wrong from the get-go. And we should have been doing more of these conversations, helping people understand, letting people ask questions, that they have, because because of these inequities, not everyone has a healthcare provider, a regular physician they can talk to. Not everyone has someone that they can, ask these questions of. So we needed, I think, early on to be doing this kind of having these kinds of spaces so people could ask their legitimate questions and make that decision, because we all had them, given, like you said, how quickly the vaccine seemed to be developed, et cetera. So, yeah.
If you're not familiar with clinical trials research, and we'll get into that in the subsequent sessions. There's a question. Oh, we're only supposed to do one part today, but there's so many questions. Let's see. I guess if you would like to talk about masks, there's a question about masks.
Right. Yeah. I mean, like I said, epidemiologists, there was a survey that went out to SCR, the Society for Epidemiology Research, and asked about mask wearing. Most thought that it would be through the end of the year. What they're saying right now in terms of unvaccinated individuals, I have seen, some of the data that says that it's unlikely that we would transmit, et cetera. But there's some complexities to this that just a blanket statement about don't wear masks, I think I don't know that that's the right approach. And Dr. Rowley, you're nodding your head, so I'd like you to chime in on that. And I think that particularly for our communities, right, where the vaccination rates are still quite low, and we're seeing that the Philadelphia data, we're seeing that there are places where it's like 19%, 15, under 20%. That whole just blanket statement, I think, will actually end up harming our communities more in the long run than helping. So, but Dr. Rowley?
I agree. And I'll tell you, last Saturday was the first time I had lunch with my friends. I had lunch with 2 colleagues who were trained at CDC in epidemiology. We ate outside. We got the table furthest away from everybody else. We had all been vaccinated, but we wore our masks when we were inside the restaurant. I think it's too early, and I'm not comfortable just going out without a mask. And you know, it was too abrupt. The vaccination rate is still too low. I just saw an article, I think my favorite journal, medical journal, I think it was either the Washington Post or the New York Times. No, actually it was Medscape. But anyway, it was about the number of people who have been diagnosed with COVID after the vaccination and the number of people who've been hospitalized. And I think we don't know what these variants are capable of. So why should I take a chance at this point? And I just want to mention one other thing. Who used the term vaccine hesitancy? It started way early in January, February, when the vaccine first came out. The media talked about it. Who benefited from thinking that Black people were hesitant? The white people who ran to Harlem and Brooklyn Heights and signed up for the vaccine because they said Black people don't want it, so we'll take their slots.
Right, and we're Philly too.
Yeah.
And I think I saw a headline where a couple flew into a Native American, you took a private flight. That's when I know, I was like, I think this is legit, but clearly other variables that factored into that. Dr. Rowley, I had my students ask me last week after class this same question, and all of the things you just talked about, the variants in different countries. You have people who might be vaccinated, not vaccinated. I was just like, it's like Teenage Mutant Ninja Turtles out there, and they cracked up. But I mean, you just don't know. And I think this is rooted in my public health journey began in HIV research, and your job is to protect yourself, right? You can't expect other people to prioritize your health. That is your job. And you try your best to make the best decision to protect your health. But I have zero expectation for anyone else on this good green planet to take care of Dorothy's child and to keep me at a lower risk of death in the midst of this pandemic. And so I said, do you want Dorothy's child or do you want Dr. Banks to give you this response? And I said, I'll be masked up until I can go in some of these government buildings and do my parties there. We are down to our last few minutes. I want to be respectful of time. Thank you both so much for dropping in, for dropping your credentials. Is there a takeaway you want to give to the people? This is your opportunity to Randy Watson, drop the mic. Is there one thing you want people to take away? And then we're going to do our final thank yous and then log off. My heart is so full.
I just have one thing to say. Deciding whether to get the vaccine if you're not vaccinated is a process that everybody has to go through, and we need to respect that process and help people along when they ask for the help. Sometimes we have to give advice when they don't ask for it, but we have to always respect the decision-making process.
Mm-hmm. Do you have a mic to drop, Diane? I can do it for you. Okay. All right, Dr. Barber.
Absolutely. Well, again, my response, we're going into this Memorial Day weekend. Some people have said we're emerging from the pandemic. And I think it's just really important for us to recognize that for some individuals and communities, the pandemic has been an inconvenience. It's been an inconvenience. We can stay at home and but for some individuals and communities, it has literally shattered their lives and communities and ways of living. And I think for me, my thing is, let us not forget the lessons, what was revealed to us in this pandemic. And the last thing I'll say is not just here in the US, but what's happening all around the globe, because there's so many spaces that are still very much in the midst of this. And I think that let's not forget that. Let's not forget the lessons, and we owe it to the lives that have been lost to use our lives and the breath we have to fight for the kind of equitable world that we all deserve. And so that's what I would say. Thank you, Dr. B. And thank you, Dr. Rowley. It's been an honor to share space with you.
Thank you both. We're going to start filing out as we do in the church. We're going to start filing on out. We can advance the next slide, please, in the chat section. These sessions are for the community, for the people. We are putting an evaluation survey in the link. We want to know what you want to learn, what you want to explore as part of the next 3 sessions. And we also want to hear your feedback about the session today. So please take a few minutes as you are wrapping up, kicking your feet up, grabbing wine, or putting your children to bed to complete that survey. I mentioned to you that these drop-in sessions were made possible because of the commitment and investment of the Ride United NC program. That link is also going in the chat for you. Dr. Barber and Dr. Rowley laid out the picture very plainly. This is not a Native American people problem, a Black people problem, a Latino problem, a rural people problem. These are systems and structures that have been at play for hundreds of years that we are trying to work away, trying to dismantle to make sure that everyone has access. In light of this pandemic and the speed at which people, as Dr. Barber said, 600,000 people have died. 33 million or 35 million have contracted COVID-19. If you are an individual who has made the decision for yourself, or if you know anyone in your community who has made the decision for themselves to get the vaccine and they need transportation support, this is a means for you to get round trip transportation, compliments of the Ride United NC program. That link is in the chat for you. The telephone number is on the screen for you. Please think about these resources. And there's so many organizations here, even in the Triangle, that are working diligently on the ground every day. The African American COVID Task Force, Latin 19, Guilford County, like there's just so many people on the ground doing amazing work. This is additional support if people need it. The last thing, so you might be asking, drum roll, what's next? Happy to serve. I see the comments in the chat. Advance the slide, we gotta go. It's 7:31. Oh, go. Next slide. Next slide, please. Next slide. Okay, what's next? When you're taking this evaluation survey, let us know. Next week, we're gonna start talking more in depth about vaccines. So if you have specific questions, if you wanna learn more about clinical trials, come. Bring your questions. The link is in the chat for you to register. This is for the community. Invite your folks. If they have questions, invite your folks. This is not the place where we're pressuring or pushing or guilting people into anything. This is a place for you to come and get the information that you need to learn more about the pandemic. There's no need for folks to be, as Dr. Barber talked about, invisible in the midst of this pandemic with all the information and resources and experts that we have. And finally, thank you. Please continue to serve, continue to share this as a resource and others that are happening around, not only in the state of North Carolina, across all 100 counties, but our sister and our baby and our daughter of North Carolina is up in Philly running things. We're learning what other people are doing in communities. The Black Doctors COVID Consortium, they're right. Like, it's amazing what they're doing. So learning from these models. And if you would like to follow, Dr. Rowley's a legend. She's like, your people can call my people. For the underlings, for the newers, Dr. Sharrelle Barber's at Health Equity Doc. I'm at Bobby Banks, and a huge thank you to United Way Triangle and the Ride United NC program for giving us an opportunity to embed and lead with health literacy to help people understand what's going on in this pandemic. Have a wonderful evening. Complete the survey. Thanks for coming out. You know the rest. Good night. All right, and have we stopped streaming now?